Reasons why heart attacks are occurring at younger ages. There are several factors that contribute to the increasing incidence of heart attacks at younger ages in recent times. Some of these include unhealthy lifestyle habits. Modern lifestyle habits such as a sedentary lifestyle, unhealthy dietary habits, stress, smoking, and excessive alcohol consumption are some of the major causes of heart attacks at younger ages. Obesity. Obesity is a growing epidemic, and it increases the risk of heart disease, including heart attacks. The availability of unhealthy food choices and lack of physical activity are major contributing factors to obesity. Diabetes. Diabetes is a major risk factor for heart attacks, and the incidence of diabetes is increasing among young adults. High blood pressure. High blood pressure, also known as hypertension, is a leading risk factor for heart disease. The incidence of high blood pressure is increasing among young adults due to poor lifestyle habits and genetic factors. Family history. Family history of heart disease is a significant risk factor for heart attacks, and the incidence of heart disease is increasing among young adults due to genetic factors. Environmental factors. Exposure to environmental pollutants and toxins, such as air pollution and industrial chemicals, can increase the risk of heart disease and heart attacks. Poor sleep habits. Poor sleep habits, including sleep apnea, are associated with an increased risk of heart attacks and other cardiovascular diseases. It is important to note that the risk of heart attacks can be reduced by adopting a healthy lifestyle, including regular exercise, healthy eating habits, stress management, avoiding smoking and excessive alcohol consumption, maintaining a healthy weight, and managing underlying health conditions such as diabetes and high blood pressure. How to prevent heart attacks at the younger ages. Preventing heart attacks at younger ages requires a combination of lifestyle changes and medical management. Here are some steps that can help prevent heart attacks in younger adults. Maintain a healthy weight. Obesity is a significant risk factor for heart disease and heart attacks. Maintaining a healthy weight through regular exercise and healthy eating habits can reduce the risk of heart disease. Exercise regularly. Regular physical activity can help reduce the risk of heart attacks. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Eat a healthy diet. Eating a diet rich in fruits, vegetables, whole grains, and lean proteins can help reduce the risk of heart attacks. Avoid processed and high-fat foods. Manage stress. Chronic stress can increase the risk of heart disease and heart attacks. Practice stress management techniques such as meditation, yoga, or deep breathing. Avoid smoking. Smoking is a significant risk factor for heart attacks. Quitting smoking can reduce the risk of heart disease and improve overall health. Manage underlying health conditions. If you have underlying health conditions such as high blood pressure or diabetes, work with your healthcare provider to manage these conditions effectively. Get enough sleep. Poor sleep habits, including sleep apnea, are associated with an increased risk of heart attacks. Aim for 7 to 8 hours of sleep each night. Limit alcohol consumption. Excessive alcohol consumption can increase the risk of heart attacks. Limit alcohol intake to no more than 1 drink per day for women and 2 drinks per day for men. Get regular checkups. Regular health checkups can help identify risk factors for heart disease and heart attacks early on. Work with your healthcare provider to develop a plan to manage these risk factors effectively. By following these steps, young adults can reduce their risk of heart attacks and other cardiovascular diseases. It's never too early to start taking care of your heart health. Preventive medical checkups for heart attacks. Preventive medical checkups can help identify risk factors for heart attacks early on, allowing for early intervention and management. Here are some recommended medical checkups for preventing heart attacks. Blood pressure. High blood pressure is a significant risk factor for heart attacks. Getting your blood pressure checked regularly can help identify high blood pressure early on and allow for management through lifestyle changes and medications if needed. Cholesterol levels. High cholesterol levels can contribute to the development of plaque in the arteries, increasing the risk of heart attacks. Getting your cholesterol levels checked regularly can help identify high cholesterol early on and allow for management through lifestyle changes and medications if needed. Diabetes screening. Diabetes is a significant risk factor for heart attacks. If you have a family history of diabetes or other risk factors, such as obesity or high blood pressure, it's important to get screened for diabetes regularly. Body mass index, BMI. Obesity is a significant risk factor for heart attacks. Checking your BMI regularly can help identify if you are overweight or obese and allow for management through lifestyle changes and medical intervention if needed. Stress test. A stress test can help identify if you have underlying heart disease that may increase your risk of heart attacks. This test involves monitoring your heart rate and rhythm during exercise to assess how well your heart is functioning. Electrocardiogram, ECG. An ECG is a non-invasive test that can help identify heart rhythm abnormalities or signs of heart damage. Getting an ECG regularly can help identify any underlying heart conditions that may increase your risk of heart attacks. Family history. A family history of heart disease or heart attacks can increase your own risk of developing heart disease. Let your healthcare provider know if you have a family history of heart disease or heart attacks. It's important to note that the frequency and timing of medical checkups may vary depending on your age, gender, and overall health status. Work with your healthcare provider to develop a personalized plan for preventive medical checkups based on your individual risk factors. Natural remedies to prevent heart attacks at younger ages. While lifestyle changes such as regular exercise, a healthy diet, and stress management are crucial for preventing heart attacks in younger adults, some natural remedies may also have potential benefits for heart health. Here are some natural remedies that may help prevent heart attacks. Omega-3 fatty acids. Omega-3 fatty acids, found in fatty fish such as salmon, tuna, and mackerel, can help reduce inflammation and improve heart health. If you don't consume enough omega-3s through your diet, consider taking a fish oil supplement. Garlic. Garlic has been shown to have potential benefits for reducing blood pressure and cholesterol levels, which are risk factors for heart attacks. Try adding garlic to your meals or consider taking a garlic supplement. Green tea. Green tea is rich in antioxidants called catechins, which can help reduce inflammation and improve heart health. Drinking green tea regularly may help reduce the risk of heart attacks. Turmeric. Turmeric is a spice that contains a compound called curcumin, which has anti-inflammatory properties. Adding turmeric to your meals or taking a turmeric supplement may have potential benefits for heart health. Coenzyme Q10. Coenzyme Q10 is a naturally occurring compound that plays a role in energy production in the body. Some studies have suggested that taking a coenzyme Q10 supplement may have potential benefits for reducing the risk of heart attacks. It's important to note that natural remedies should not be used as a substitute for medical treatment or advice. If you have any concerns about your heart health, speak with your healthcare provider before starting any new supplements or